Good afternoon, Facebook. It's Neville with Two Wheels, One Cause. We're going to learn a little bit about diabetes today. Our awareness effort has been going on since 2014. I've been riding cross country, started in Florida, heading out west to LA. Last year, did almost 8,000 miles when I went from Florida to Seattle, LA, and back on a solo ride. We reached more than 1 million people last year alone, so we're looking to exceed that about 10 times that this year. So I'm here with Dr. Camille Hippolyte, and we are going to discuss diabetes awareness and the things that you might need to do to find out your status, the importance of finding out your status, and things you can do to kind of maintain your sugar levels as you move forward. Hello, Camille. How are you doing?
Good. Thank you for having me.
All right. Excellent. Excellent. So you've been a doctor for 4 years?
I've been a doctor for 7 years and 4 years out of residency now.
Out of residency. Wow.
Yes.
Man, that's amazing. That's amazing. Glad to have you here. She is my doctor. She knows the ups and downs of my A1C. So there's nothing I can hide from her in that respect. But tell us about diabetes and the importance of finding out as early as possible your status.
Well, there are several different types of diabetes, but I'll just talk about diabetes type 2, which is very common in the United States right now. Actually, not only in the United States, but in other parts of the world. And diabetes develops in a way where you start developing insulin resistance. And there are several risk factors that are involved, and you can find out early whether you are high risk for diabetes or whether you are low risk for diabetes. Now, the American Diabetes Association have resources available online where you can actually take a short screening test, putting in those risk factors and giving that score to let you know whether you are at high risk.
And we'll be actually, I hate to interrupt, we'll actually be passing around that test as I ride along. Each major city I stop in, I'm going to get a new bundle of risk tests and events and different things that we have. Heck, when I stop at the gas station, if somebody says they want to take the risk test, we'll do that. So that's one of our major pushes this year on the ride.
That's amazing. I recommend you take that test.
Yes, indeed. Yes, indeed. So one of the other things, we got a lot of feedback on a video we posted a couple weeks ago where they compared a Diet Coke to a regular Coke, and it actually was more sugar in the Diet Coke. Can you kind of explain that phenomenon for us so people can understand what that means to them as they make these purchasing decisions?
Very good question.
Mm-hmm.
I actually have a little example here of an item that you can probably use every day, and I will give you some practical measures on how you can determine whether an item has more sugar than it's perceived to have more sugar, or whether it is a good source of low sugar. Okay. All right. So as you know, peanut butter is very common item in the American household. Okay, I personally love peanut butter. Okay, when you go to the supermarket, oftentimes you would find things either labeled reduced fat or the original. Not only for peanut butter, for countless things. Okay, I'm using peanut butter as one example. This here is reduced fat peanut butter, and this here is the original peanut butter. Okay, now most people would gravitate towards taking the reduced fat peanut butter, but I want to let you know that when you take that peanut butter and look on the back at the nutrition label, you look for the label saying total carbohydrates, and under total carbohydrates would be a breakdown of the sugar. Now the serving size for this peanut butter is 2 tablespoons. The serving size for this peanut butter is also 2 tablespoons. In this one serving size has 15 grams of carbohydrates, including sugars. In this one, it has 8 grams of sugars, or total carbohydrates. So the original peanut butter has half of the sugar as the reduced fat.
What?
So this reduced fat peanut butter has double the amount of sugar as the original. So for my diabetic patients out there, I would recommend proceeding to buy non-reduced fat original brands of most of your products out there, because usually reduced fat means more sugar added.
So when I have my glasses glasses on at least. I go and check the sugars, right here. And I say, oh, okay, it's only 3 grams of sugar, but I need to actually pay attention to the carbohydrates.
The total
So
carbohydrates.
and on top of the sugar, so I add that, or is that the number that I need to pay attention to?
That's the number you need to pay attention to. The total carbohydrates would already include the
amount of sugar that's involved.
Exactly.
Okay.
Exactly.
Wow, that's amazing. Now I don't know who all eats 2 tablespoons of peanut butter, but
I can eat 4 in no time.
Exactly, but at least you know what you're getting in that regard. Now, how misleading is sugar? Like from my research, I realized there's 20 plus names for sugar alone. Not including the carbohydrates, but just sugar alone.
Yes, there are a number.
How do we combat that?
So a good way to combat that is actually label reading. Label reading is very important.
Mm-hmm.
So sugars can come up with a variety of different names, sucrose and fructose and all these things.
Mm-hmm.
And so looking at your labels is very important because they may say no sugar, but when you look at your ingredients in there, you will find some sugar in there. So very important. Okay?
That's amazing. So basically, everybody, we want you to tune in to Two Wheels One Cause on Facebook and all your other social media. Take the risk test. If you don't find us on our journey somewhere, locate your local ADA office and or look them up online, the American Diabetes Association, and take that risk test. That's very important to kind of see where you are or the status of a loved one as well. The other thing is pay attention to these labels. They want to sell product, and we're not just kind of pulling out Jif as one of many.
It's for all products.
We're not. Yeah, it's for all products. But that's very important to understand. That I had no idea it was double. So just be informed, just like you would be informed about anything else. Be informed about your health, your process, what you consume, and so forth and so on. So thanks again, Dr. Camille.
Thank you for having me. I appreciate that.
And thank you guys, and stay tuned.